All right, welcome everybody to our pre-application technical assistance webinar for the state-based healthcare extension cooperatives to accelerate implementation of actionable knowledge into practice. We have a page here with the Zoom information and the phone options for calling in case you're having any IT issues. If you have connection issues, please email us at arc_hes@arc.hhs.gov. That email is also in the chat. With that, we're going to begin the webinar. For our agenda today, we're going to give you the contact information to get a hold of us as you have questions as you're preparing your application. Go over a brief background on AHRQ's healthcare extension service, then dive into the requirements and review criteria for this specific Notice of Funding Opportunity, or NOFO. At the end, we're going to review some frequently asked questions. So a couple of things to go over before we begin. This presentation generally summarizes the information in the NOFO, but please refer to the actual NOFO or RFA for the exact details, as that is the final source of guidance. Additionally, some of you may have noticed that a notice of change was published yesterday, September 26th, with regards to this NOFO, and this webinar incorporates all the information that came through on that notice of change. Lastly, we're going to respond to the frequently asked questions that we received prior to this webinar at the end. If you have additional questions as they come through, please send them to our email address. We won't be monitoring or responding to the questions that come through via the chat, just because of the timing of the overall webinar, but we will get back to everybody with questions via email. So for today, I'm joined by my colleague, Ellen Deutsch, who's a physician in the Division of General Patient Safety in the Center for Quality Improvement and Patient Safety here at AHRQ. She has been my co-author and support and colleague throughout the publication of this NOFO. And I am Matthew Simpson, a physician within the Division of Practice Improvement in the Center for Evidence and Practice Improvement here at AHRQ. If you need to get a hold of us about any scientific or research questions, please email us at arc_hes@arc.hhs.gov. And that's AHRQ_HES for Healthcare Extension Service at arc.hhs.gov. We also have the contacts listed for any peer review questions, as well as any financial or grants management questions. When in doubt, just send us an email to the arc_HES@arc.hhs.gov, and we can always route the question if needed. With that, we're going to dive into a brief overview of the overall healthcare extension service. So the goals of the healthcare extension service are to accelerate the dissemination of implementation of patient-centered outcomes research evidence into practice in order to improve the quality of care delivered within states, healthcare delivery organizations, and the populations that are served by these people. Additionally, there's a goal to reduce the healthcare disparities among people who receive Medicaid, people who are uninsured, people who are medically underserved. And in order to do that, the healthcare extension service will address barriers and facilitators at multiple levels, such as policy and payment structures, workforce issues, health information technology, and coordination of improvement activities. The Healthcare Extension Service has some key features that have been modeled after the Agricultural Extension Service and incorporating principles from learning health systems. There's three main components. First is the state-based cooperatives, which this funding announcement will be talking about. That's focused on using PCOR evidence to improve care for the medically underserved. The National Coordinating Center will provide technical assistance to these state-based cooperatives and establish learning networks to try to facilitate learning across the cooperatives and connect cooperatives with resources at the federal level to improve the implementation of PCOR evidence. The National Evaluation Center will be responsible for developing data, measures, and methods for assessment and delivering the summary report of the overall healthcare extension service. This has all been guided by AHRQ's Patient-Centered Outcomes Research Trust Fund strategic framework and maps nicely to that framework, which can be found on the AHRQ website. And with that, we are now going to go into The specific funding announcement focused on state-based healthcare extension cooperatives to accelerate implementation of actionable knowledge into practice. The purpose and objective of this funding announcement is to accelerate the dissemination and implementation of patient-centered outcomes research evidence into healthcare delivery through improvements in healthcare policy, payment, and practice. Each cooperative will conduct an initiative based on PCOR evidence to improve care for medically underserved people. The initiative will focus on behavioral health. In order to conduct this initiative, the cooperative will have three main components. First will be the engagement, training, education, and assistance core. Next is the monitoring, feedback, and evaluation core. And lastly is the administrative core, which will include a multi-stakeholder council. Each cooperative will coordinate with the National Evaluation Center and the National Coordinating Center. This visual depicts the relationship between the state-based cooperative, its three cores, and the National Coordinating Center, National Evaluation Center, and cooperatives from other states. Our goal with the state-based cooperative NOFO is to implement a behavioral health initiative supporting safety net organizations. Here are the key dates for this NOFO. Calling out in bold and italics is the application due date, which is now January 6, 2025, based on the notice of change that was just issued on September 26th. The letter of intent is due 30 days prior to that, and while it's not required, it is strongly encouraged. The earliest start date is about 4 months after the peer review date. I also want to highlight that this NOFO is a one-time call for applications. For this funding announcement, we're going to use the U19 Cooperative Agreement mechanism. With this, the cooperative agreement is a financial assistance mechanism used when there will be substantial federal, scientific, programmatic involvement. What that means is that after award, AHRQ scientific or program staff, such as myself, will assist, guide, coordinate, or participate in the project activities. Section 6.2, Cooperative Agreement Terms and Conditions of Award, has specific activities that the awardee and the AHRQ program staff will have under the conditions of this award. We anticipate awarding up to 15 grants through this funding announcement. For the budget, you cannot exceed $6.25 million in any given year, and you cannot exceed $25 million total cost over the entire project period. What this means is that applicants may propose different total annual budgets based on their scientific approach, as long as they stay within that $25 million total cost over the 5-year period. Now, with the letter of intent, this will be due December 6th. It is strongly encouraged. It is not required, and it does not obligate the sender to apply, and is not considered in the review of a subsequent application. AHRQ strongly urges potential applicants in a state to collaborate on a single application. Submitting a letter of intent gives AHRQ permission to share that letter of intent information with other submitters from the same state in order to help make linkages and facilitate that potential collaboration. If you're interested in submitting a letter of intent, please include the descriptive title of the proposed activity, names, addresses, and telephone numbers of the PDs or PIs, names of other key personnel, participating institutions, and the number and title of this NOFO. And please submit that letter of intent to arc_HES@arc.hhs.gov. All right, now we're going to move into the NOFO requirements, where we're going to go through the requirements for the 3 cores as well as the Behavioral Health Initiative. For this first core, I'm going to pass it over to my colleague Ellen to explain.
Next slide, please. So the first core is the Engagement, Training, Education, and Assistance core. the high-level requirements are to establish and maintain relationships with healthcare delivery organizations and community partners, and support improvement goals of the initiative. Also, to assist healthcare delivery organizations develop an implementation plan and facilitate learning across the state. Next slide, please. This core includes healthcare extension agents. The agents will provide external support to improve population health by improving the healthcare delivery system and by working to achieve the goals of the cooperative. The healthcare extension agents, the healthcare extension agents assist the safety net healthcare delivery organizations in developing an implementation plan. This plan must include the ability to tailor the implementation strategies to improve the fit with the healthcare delivery organizations and to make adaptations to address the needs of different populations in the organizations that are served. There are the healthcare extension agents, examples of healthcare extension agents include education and training professionals, health information technology advisors, human factors, systems engineering or task analysis experts, implementation experts, and practice facilitators and coaches. The activities of the healthcare extension agents include such activities as convening learning communities, providing tailored support to healthcare delivery organizations, engaging managed care organizations, working with community-based organizations, presenting information to policymakers and payers, assisting with health information technology, analyzing and improving work processes and workforce composition, and addressing healthcare workforce needs through training and education. The healthcare extension agents must focus on safety net healthcare delivery organizations, but may also work with other organizations. Next, thank you. The purpose of this core is to facilitate learning across the states. The cooperative must develop relationships with members of the safety net healthcare delivery organizations, healthcare professionals, and other partners to facilitate shared learning through the initiative. This may include activities such as sharing local barriers and corresponding solutions, sharing local facilitators, sharing methods for meaningful engagement and partnership with communities, sharing resources from other state and federal initiatives to improve the initiative's implementation, and sharing interim evaluation results. And I will turn this back to Dr. Simpson.
Thank you very much. I'm going to go through the requirements of the monitoring, feedback, and evaluation core. So there are 5 main requirements within this core. Those are to collect and analyze qualitative and quantitative data to inform, monitor, and evaluate the cooperative's improvement initiative. Collect and summarize P-Core evidence on improvements and strategies for the cooperative's initiative. Monitor the cooperative's activities and performance. Use self-monitoring and local evaluation data to support ongoing improvement of the initiative. Evaluate the cooperative's implementation and impact. These activities must be performed by an organization within the state that can conduct a rigorous and independent evaluation. To go in a little bit more depth on the monitoring requirement, this core will be responsible for monitoring and collecting data on the cooperative's governance, operations, and functioning, as well as the initiative, and share these data with the NEC, or National Evaluation Center. It must also report to the NEC on common measures of practice context, practice level capacity, implementation, and process measures regarding the initiative's development, uptake of improvements, and implementation strategies. The applicant must propose monitoring metrics and other measures, recognizing that cooperatives will ultimately develop and use standard reporting measures identified in collaboration with the NEC after award. Each cooperative may collect additional data beyond these standard reporting measures. For the feedback and improvement element of this core, Applicants must propose an approach for using the self-monitoring and local evaluation data to support ongoing improvement of the initiative. Applicants must detail a process for sharing monitoring and local evaluation data within the cooperative to inform subsequent improvements. Must share the monitoring results and information regularly with partners in the state or sub-state region, as well as the National Coordinating Center, or NCC. And they must take this data and translate the findings into information useful for the cooperative, the multi-stakeholder council, the healthcare delivery organizations, and decision makers across the state. And lastly, with regards to the implementation and impact evaluation, the cooperative must look at the following elements: the implementation of the overall cooperative itself, the improvement in the organizational outcomes from the cooperative's activities, the role of health information technology in the overall initiative and cooperative, the adoption, implementation, and sustainment of the Peak 4 evidence-based, patient-centered healthcare delivery improvements throughout the initiative, the impact of the cooperative and its initiative, and the impacts on health equity. Next up, we have the administrative core, where I'll hand it back over to my colleague, Dr. Deutsch.
Thank you. So the third core of this set of three is the administrative core. Next slide, please. At a high level, the requirements are to manage, coordinate, and support the activities of the cooperative and the initiative, and to establish the multi-stakeholder council to provide expert advice and guidance to the cooperative. And first, we'll speak about the management activities and then the composition of the multi-stakeholder council. So the administrative core has coordination functions to identify and coordinate with other similar initiatives in the state to develop collaboration opportunities and reduce duplication. The administrative core cooperates and collaborates with the National Coordinating Council, and they cooperate, collaborate, and partner with the National Evaluation Center. And the purpose is to harmonize measures, instruments, and data collection across the cooperatives, share instruments and data with AHRQ and with the NEC, participate in evaluation activities with the NEC, review evaluation reports from the NEC, and identify key actions based on the report findings. Next slide, please. The other important responsibility of the administrative core is developing the multi-stakeholder council. The council has a responsibility to provide expert advice and guidance to the cooperative. The multi-stakeholder council must guide the cooperative's initiative, which will be focused on behavioral health, using a data-informed and collaborative process with a facilitator. The council must also support the implementation of the cooperative's initiative by providing input, including potential adaptations to enhance its success. Proposed adaptations must be within the original scope of the approved grant award. Next slide, please. Additional responsibilities of the multi-stakeholder council are to provide guidance and support state and local level guidance and support about state and local level barriers and facilitators to improvements that are part of the initiative, such as providing recommendations to align payment policies and performance metrics, identifying workforce issues, enhancing timely and consistent data sharing, or developing healthcare delivery workflows and processes for healthcare delivery organizations. The council will also support coordination with state-level efforts to improve healthcare policy, payment, and practice for safety net healthcare delivery organizations, which may include assisting with coordination of other improvement efforts or leveraging state or local resources. And finally, the council will evaluate the cooperative's potential for long-term sustainability, including identifying opportunities for ongoing support. Next slide, please. The membership of the multi-stakeholder council is very important. Applicants must include at least one member from each category listed below. And these are a representative from the state Medicaid agency or agency that manages Medicaid. Such a representative must be a full and active participant in the multi-stakeholder council. There must also be a representative from Medicaid Managed Care Organizations, or MCOs, if applicable in that state. If the applicant's state Medicaid funded services are primarily delivered through MCOs, a representative from the largest managed care organization must be included. The council must include an executive from safety net healthcare delivery organizations, clinicians and staff from safety net healthcare delivery organizations, patients, families, and caregivers who receive care from safety net healthcare delivery organizations or who are members of underserved populations. And additional members should include stakeholders relevant to the initiative of the cooperative and the state's healthcare landscape. Next slide, please. And I will turn this back over to Dr. Simpson.
All right, thank you. Next, we're going to go through the requirements for the Behavioral Health Initiative. So with this initiative, I want to highlight a few definitions that are in our key terms section of the Notice of Funding Opportunity, or NOFO. For behavioral health, we would use an umbrella term that includes mental health and substance use conditions, life stressors and crises, stress-related physical symptoms, and health behaviors. We also refer to an evidence-based, patient-centered healthcare delivery improvement, or an evidence-based improvement for short, as a healthcare delivery intervention, program, education, training, practice, process, guideline, and policy with some evidence of effectiveness in improving health outcomes that are meaningful for patients and their caregivers. This includes clinical evidence, evidence on how to best deliver healthcare that is potentially generalizable beyond specific health conditions or healthcare delivery circumstances, such as management strategies or models of care, or evidence-based policies. With those definitions in mind, each cooperative must conduct an initiative focused on behavioral health to accelerate the dissemination and implementation of patient-centered healthcare delivery improvements based on PCOR evidence and reduce disparities in safety net healthcare delivery organizations. Applicants must specify the behavioral health focus of the initiative, including the evidence-based patient-centered improvements to be implemented. They should determine the behavioral health focus using state data, PCOR evidence, data on health and healthcare disparities, and consultation with current or anticipated members of the Multi-Stakeholder Council. Applicants must also describe a process by which the implementation of the evidence-based improvement will be refined throughout the initiative based on input from the Multi-Stakeholder Council, the healthcare extension agents, and data from the Monitoring, Feedback, and Evaluation Core. All right, now we're going to switch gears and go through the required elements for the research strategy. Please refer to Section 4, Application and Submission Information for full details. This is a multi-component application, and as you can see, there are 5 components below. There's the overall, the administrative core, the engagement, training, education, and technical assistance core, the monitoring, feedback, and evaluation core, and the behavioral health initiative. Each of these components is required, and the research strategy for each of these has a 6-page limit. For the overall component, there's 2 main sections that are required. First is the state-based healthcare extension cooperative overview, where applicants must describe how the cores contribute individually and collectively to achieve the goals of this NOFO. Must also describe the experience and capacity of investigators to engage in the proposed work, including relationships with key stakeholders. Applicants must also describe responsiveness to the state healthcare environment, including the characteristics of healthcare in the state and any known challenges that exist. Applicants must also describe how they'll build sustainable learning and improvement systems at the state level to accelerate implementation of evidence-based improvements in healthcare policy, payment, and practice. Applicants must also describe current healthcare disparities in their state and how their proposed work may address those disparities. With regards to the administrative core, you must clearly indicate the state that the applicant will be working in. And with that, describe the staffing structure, leadership, and governance of the cooperative, the timeline and mitigation strategies, the multi-stakeholder council, Cooperative's relationship with other organizations and initiatives, the coordination with state-level convenings of state Medicaid agencies, payer partners, and other stakeholders, and the Cooperative's finances, including any in-kind support, and how the Cooperative will ensure equitable distribution of funds among partners and organizations. This section must also include how the multi-stakeholder council members will prepare for operations after the end of this award. The Administrative Corps has a requirement to have a letter of support from the state Medicaid agency, which must include the commitment to participate in the multi-stakeholder council, identify specific individuals within the state Medicaid agency who will participate in the cooperative, and detail the role that these individuals and the state Medicaid agency will have within the cooperative. Additionally, the application must include letters of support from collaborating organizations and individuals which document specific contributions. Now, for the Engagement, Training, Education, and Assistance Corps, the applicants must describe their approach to engaging safety net healthcare delivery organizations and clinicians to establish and maintain relationships or build upon previous relationships. They must also describe their approach to designing and delivering implementation support and facilitating learning across the state or sub-state region. For the Monitoring, Feedback, and Evaluation Corps, the applicants must describe the data sources, their approach to analyzing and sharing data, the approach to monitoring the cooperative activities and performance and providing feedback for improvement, the approach to evaluating the cooperative's processes and outcomes, and the incorporation of health equity into the overall monitoring, feedback, and evaluation activities of the cooperative. For the Behavioral Health Initiative, applicants must address the behavioral health focus of the initiative, including why and how the behavioral health focus was selected, the scientific premise for the proposed initiative, how the proposed initiative will address disparities, and the proposed evidence-based approach to implementing the initiative. They must also include the timeline for implementing the initiative with major milestones and plans for collaborations with community partners. Up next, we're going to review some of the eligibility information and other requirements for this grant. With regards to eligibility, please refer to Section 3, Eligibility Information, for the full details. Broadly speaking, the following types of organizations are eligible to apply: higher education institutions, nonprofits other than institutions of higher education, for-profit organizations, local governments, federal governments, and other organization types. The text that's in bold and italics here came through on the notice of change that was just published on September 26th, and that says that applicant organizations may submit more than one application to this NOFO, provided that each application is scientifically distinct. Applications that describe proposed improvements in healthcare policy, payment, and practice work to be conducted in more than one state will be deemed non-responsive and will not be reviewed. In addition to these requirements, we also have some budget requirements as part of this NOFO. If you're proposing a single PD or PI application, that person must devote at least 20% minimum FTE in each given year of the project. If you're proposing a multi-PD or multi-PI plan, each PD or PI must devote at least 10% minimum FTE in each given year of the project. For the actual cores and initiative, there are no requirements for the level of effort. With regards to travel, applicants must budget for up to 4 key personnel to travel to the Washington, D.C. area once each year for a meeting of the grantees. Applicants must also budget to have an evaluation liaison to the National Evaluation Center, and that person must be designated at key personnel and have at least 25% FTE dedicated to evaluation liaison activities. All right, now that we reviewed all the requirements of the grant, we're going to talk about the review process. So upon receipt, applications will be reviewed for administrative criteria, and incomplete or non-responsive applications or applications not following instructions given in this NOFO will not be reviewed. Applications that are complete and responsive to the NOFO will be evaluated for scientific and technical merit by an appropriate objective group convened in accordance with standard AHRQ peer review procedures. And for this NOFO, that group will be a special emphasis panel convened for peer review of these applications. With regards to that, they'll have an overall impact score, some scored review criteria, and some additional review criteria that they will take into consideration. The overall impact score will provide an overall assessment and reflect the likelihood that the project will exert a sustained, powerful influence on the research fields involved. The scored review criteria fall into the following 5 categories of significance, investigators, innovation, approach, and environment. Now, an application does not need to be strong in all 5 of these categories to be judged likely to have a major scientific impact. For example, a project that by its nature is not innovative may be essential to advance a field. With that in mind, we're going to go through the review criteria for this funding announcement over the next few slides. With these slides, in the purple table are the standard or commonly used review criteria for our AHRQ grants. The criteria that fall outside of that table are the ones that are specific to this funding announcement, and those will be the ones that I'll review on the webinar here today. So for significance, first review criteria is how will successful completion of the proposed work result in new sustainable capacity to increase the delivery of P-Core evidence-based improvements in the state? How will successful completion of the proposed work reduce disparities within the state in the delivery of P-Core evidence-based interventions to safety net populations? And how does the proposed work support a significant increase as opposed to a modest incremental improvement in the state's capacity to disseminate and implement P-Core evidence-based improvements for safety net organizations? With regards to the investigators, there are 3 NOFO-specific criteria as follows. Do the PDs or PIs have experience working in the state and with key stakeholders in the state, including payers and healthcare delivery organizations that address the health needs of people who are underserved? Is the single PD or PI devoting at least 20% minimum FTE in each given year of the project? Are the multiple PD, PIs each devoting at least 10% minimum FTE? And is the liaison to the NEC devoting at least 25% FTE to the evaluation liaison activities? With regards to innovation, we are following the standard review criteria for our AHRQ grants. For the approach, we have 1 NOFO-specific criteria, which is to what extent has the applicant demonstrated a clear understanding of the context of healthcare delivery in the state, including safety net healthcare delivery organizations and geographic diversity, and the need for this program and the planned activities. For the 5th element of environment, we have 1 NOFO-specific criterion, which is to what extent do letters of support from collaborating organizations and individuals indicate substantial engagement and document specific contributions of the partner during the proposed collaboration. In addition to the review criteria that fall into those 5 categories, we have review criteria for each of the specific cores and components of the application. For the engagement, training, education, assistance core, we have 2 NOFO-specific criteria. First is how effectively will the applicant's proposed approach facilitate learning across the state or sub-state region? Second is how effectively does the applicant's proposed approach utilize healthcare extension agents to provide support for dissemination and implementation of P-Core evidence-based improvements? For the monitoring, feedback, and evaluation core, we have 3 NOFO-specific criteria. How likely is it that the monitoring and feedback activities will enable the cooperative to refine and improve its cores and the initiative? How likely is it that the evaluation will provide valid and useful information for state and national stakeholders? Are the evaluation questions clear, meaningful, and consistent with the objectives of this NOFO? For the administrative core, we have the following three NOFO-specific review criteria. How well does the applicant's proposed approach fulfill the requirements of the administrative core? How effectively will the applicant's proposed approach create a multi-stakeholder council that can provide guidance and support for the Cooperatives initiative? How effectively does the applicant's approach create a multi-stakeholder council that includes participation from safety net healthcare delivery organizations and patients, families, and caregivers that represent the state's diversity? And for the initiative, we have two NOFO-specific review criteria. How likely is it that the approach of the initiative will accelerate P-Core evidence-based improvement? How effectively will the proposed initiative address the needs and priorities of the state? There are also these following 5 categories of additional review criteria, and reviewers will comment on whether the data management plan is reasonable and assess the adequacy of the plan to the inclusion of priority populations, and review the degree of responsiveness of the application to the overall NOFO, as well as review and comment on the protections for human subjects and the budget and period of support. After the peer review process, we then proceed with making funding decisions, and these are the following considerations that we make when making those funding decisions. We will review and consider the scientific and technical merit of the proposed project, the availability of funds, responsiveness to NOFO goals and objectives, proposed approach to addressing health equity, and the relevance and fit within AHRQ research priorities and overall programmatic and geographic balance of the proposed project to program priorities. In the next few slides, we're just going to review the required performance measures that are within the Notice of Funding announcement. Please see the NOFO for the reporting timeline. With these are the bare minimum set of measures that we will be reporting on with regards to these grants, and should it definitely be included in your thought as you plan for the application. So with regards to reach, we'll be looking at the number and type of stakeholder participating in the multi-stakeholder council, and the number, type, and size of safety net healthcare delivery organizations served by grant-supported healthcare extension services. With regards to structure and process, we'll look at the number of multi-stakeholder council meetings conducted and the number of participants attending, the number and type of healthcare extension agents hired or employed, the number and type of policy payment or practice improvement activities planned and implemented, the number and type of monitoring activities conducted and the impact on program activities, as well as the costs and resources associated with implementing the healthcare extension service. With regards to impact, we'll look at improvement in outcomes and equity measures relevant to the projects selected by the cooperatives, experience and satisfaction of organizations and individuals reached by extension services, decision-making informed by patient-centered outcomes research, patient-centered outcomes research implemented in clinical practice, and the use of behavioral health services targeted by state-based healthcare extension services. All right. This is exciting news as well. So yesterday, September 26th, just released the 2 companion funding announcements for the National Coordinating Center and the National Evaluation Center. These can be found on the AHRQ website. We have a web page on our Healthcare Extension Service site that has technical assistance resources for applicants to AHRQ's Healthcare Extension Service. This includes resources for applicants to this funding announcement, as well as to the National Coordinating Center and the National Evaluation Center funding announcement. This page will also be updated with information on the pre-application technical assistance webinars for these NOFOs. And with that, we are going to move to the last section of the webinar today, which are the frequently asked questions. So these were questions that we received to our inbox via email prior to this webinar we're going to respond to. A reminder that after this webinar, if you have further questions, please do email us and we will respond to you with answers. These frequently asked questions will be compiled into a document and posted on AHRQ's website along with the slides and recording from this webinar. That will occur approximately 1 week after this webinar today. So the first frequently asked question was, is the PI organization independent enough to conduct a rigorous and independent evaluation? So just to remind folks, the text from the NOFO says the monitoring, feedback, and evaluation activities must be performed by an organization within the state that can conduct a rigorous and independent evaluation, such as an academic medical center, public or private institutions of higher education, or other research organization. If the applicant organization cannot independently perform this, they must partner with an organization that can perform these tasks. So with that NOFO requirement in mind, there are no specific requirements about where the individuals with the monitoring, feedback, and evaluation core are housed within an organization, school, or department. The applicant should describe the relationship between the monitoring, feedback, and evaluation core and the other cores in the cooperative to explain how it can conduct a rigorous and independent evaluation. Areas to consider may be whether personnel work on multiple cores, what are the supervisory relationships, and independence of decision-making by the monitoring, feedback, and evaluation team or organization. Second question is, what is the relationship between the cooperative recipients and the NCC or National Coordinating Center and the NEC or National Evaluation Center? I'd like to refer you to Section 6.2, the Cooperative Agreement Terms and Conditions of Award for the full details. I will state that the PDs or PIs will have the primary responsibility for operating the cooperative in accordance with the terms and conditions of the Notice of Award, as well as cooperating with other key parties, such as the AHRQ program official, other cooperative recipients, the National Coordinating Center, and the National Evaluation Center. Next question, do applicants need to use AHRQ resources for PCOR evidence? No, applicants may draw upon many sources of PCOR evidence and does not need to come from research or materials supported or published by AHRQ. Examples of sources of PCOR evidence include, but are not limited to, AHRQ's evidence reports. Next question, what is the role of the state Medicaid agency for this application? There are a few places in the NOFO where this is mentioned. First is with regards to the Multi-Stakeholder Council. A representative from the state Medicaid agency or agency that manages Medicaid is required to be a full and active participant in the Multi-Stakeholder Council. Where possible, they should work to align payment and performance metrics with the initiative's improvement goals and facilitate Medicaid data sharing and analysis with the cooperative. The applicant must also describe how they will coordinate with state-level convenings of state Medicaid agencies, payer partners, and other stakeholders and innovation models from the Centers for Medicare and Medicaid Services Innovation Center. Additionally, I want to highlight that applicants must submit a letter of support from the state Medicaid agency. Section 4, Application and Submission Information, gives all the details for this requirement. Next question. How many initiatives are the state-based healthcare extension cooperatives expected to conduct over the entirety of the 5-year funding period? This question has come up because prior to the publication of this NOFO, there were mention of potentially more than one initiative. This is a good reminder that the NOFO is the final source of guidance on all requirements for the application. With that, applicants are to propose one initiative with one behavioral health focus, but could potentially propose additional activities as long as they are responsive to the NOFO requirements. An initiative may focus on a single area or a combination that will accelerate the implementation of PCOR evidence in practice and can incorporate more evidence-based improvements or implementation strategies at multiple levels, such as clinical, policy, or payment improvements that may target multiple outcomes. I'd like to point applicants to the fact that we have several examples of initiatives into the NOFO as well, where you can see what this looks like, where there's a single initiative with a single behavioral health focus that touches on multiple areas with multiple evidence-based improvements to try to drive to the same goal to improve the implementation of PCOR evidence focused on one behavioral health topic. The next question is, for the behavioral health initiative, is a shift in or additional focus appropriate and allowed within the overall behavioral health focus if data, stakeholder input, and/or evidence emerged indicates. So within the NOFO, we have written that applicants must describe a process by which the implementation of the evidence-based improvements will be refined throughout the initiative based on input from the Multi-Stakeholder Council, the Healthcare Extension agents, and data from the Monitoring, Feedback, and Evaluation Core. Members of the Multi-Stakeholder Council will also provide input during the initiative's implementation, including potential adaptations to implementation strategies to enhance its success. I will note that proposed adaptations to the implementation strategies approved for the grant recipient must be within the original scope of the approved grant award. And with that, we're now going to wrap up our pre-application technical assistance webinar. So to summarize a few key dates, the letter of intent is due December 6th. It is encouraged but not required. The full application is due January 6, 2025 by 5 p.m. local time of the applicant organization. If you have any questions about what we covered in the webinar today or the funding announcement itself, please email us at arc_hes@arc.hhs.gov. If you have any questions about peer review, please contact our colleagues in the Division of Scientific Review or our colleague in the Financial and Grants Management for any questions related to those aspects of the grant. This presentation will be posted on AHRQ's website on the Notice of Funding Opportunities page, along with the slides and the frequently asked questions that we reviewed, as well as any other frequently asked questions that come in. And as a final reminder, I think this might be the third time saying it, please refer to the NOFO as the final source of guidance for all things on this funding announcement. With that, I just want to offer you my sincere thanks for attending today, listening to us walk through this NOFO, and all the interest that we've received. Please do keep the emails coming. We have enjoyed interacting with folks who are interested. Please do submit a letter of intent to us and stay in touch as we move forward with this exciting funding announcement. Take care, everyone.